My name is Denise Knighton. I currently work as PA in Health and Wellbeing Service for clinical psychology. It's part of the new IEPT service. I've worked in the NHS for 50 years from the 1st of April 2018. My first job was as a short-term typist straight from college. I was working at the Royal Infirmary in Sheffield in the haematology department. I left the NHS for about 6 months and then returned when my college tutor invited me to apply for a job at the Northern General Hospital, and that role again was as a PA to a consultant haematologist. I was there for 18 months, and after that I applied for a job working for the matron of the hospital. I spent 2.5 years with her, and then I was promoted to be in charge of admin in the nurse training school, and that was very interesting again. It was a great job. I really enjoyed that and stayed there for 3 years. The reason I left that job was because my dad died and I wanted to spend more time with my mum. So I then thought I would go back into clinical because I really did like clinical work, or admin work connected with clinical work. So I applied for a job working for Geoffrey Smith, who was the consultant cardiothoracic surgeon. He was doing some of the more recently introduced cardiac surgery, coronary artery bypass graft, which now is really well known. But in those days it was quite new. Not all the surgeons wanted to perform it. So it was really good. I think that was probably what I think was the most responsible job that I've had in the NHS. It was lovely. I really enjoyed it, and I left there because I was pregnant. After my daughter was born in 1978, I went more or less straight back and worked at the Royal Hallamshire Hospital. The main building was being opened at that time, and they were, for the first time, as far as I knew, in the NHS, employing admin staff at weekends and bank holidays. So that was quite interesting. I did that until 2001. But in addition to that, in 1989, I applied for a job in Sheffield Health and Social Care Trust. At that time, it was the mental illness unit, which changed to the mental health unit, because that was a more positive name. And it later became Community Health Sheffield and Sheffield Health and Social Care Trust, and then a foundation trust. So from 1989 until this time, I've been working in psychology. Initially, I worked in adult mental health psychology, which is mainly community, not inpatient. And then I was wanting to reduce my hours and sort of semi-retire. So I was offered this job working with clinical work again, which is really my main interest. I love working with patients. It's the reason I came into the NHS. I love to speak to people. I like to try to help people. And I feel that one of the most important things that we do is to be compassionate and kind, and to actually make, even if we're really busy, we don't want the patients to know that we are. I think one of the most important things we can do is to just have the time to explain things to them and get back to them if we need to. So I think it's been, the joy of my life has really been, work-wise, to actually meet and try to help patients in telephone calls and other ways. I wouldn't work anywhere else. I have no desire whatsoever. I've always wanted to be where the patients are. And I feel that if I could do it all again, I would. I don't even think I'd want to particularly change what I've done. Although it's not the best paid job in the world, for me it's been a job that I feel is responsible, caring, and makes a difference in some way. For me it's the people. So whether it's the clinicians that you're working with, or the patients, or just the staff that you come into contact with every day. There are small teams, and then you're within a larger team and a larger team until you've covered the whole of the trust. And we all have a part to play. And I really do believe in the reasons that the NHS was started in the first place. My grandma died at the age of 42 of septicemia because they couldn't afford a doctor. They didn't send for a doctor. She could have lived a good many years if she'd have had the care that she needed. And I hate to think that anyone would not get the care that they need because they can't afford to pay for it. Goodness, yes, technology. When I came back to work for Sheffield Care Trust, my boss, who was a chief psychologist, had brought in an Amstrad computer. We didn't have them in the trust at the time, but we'd got this Amstrad computer which worked with discs, and I can remember thinking, oh my goodness, I'll never be able to do that. It was the best thing that I'd ever seen. And other things I think as well, another big one is change to electronic records. That's made a huge difference. I love the Insight system, which is our patient recording system. Life is so much easier with it. The future for me is to stay here as long as I feel able to make a contribution. My colleagues have already been asked to tell me when I start forgetting too many things. I say, Denise, you know, your memory's not as good as it used to be, it's time to go. So then I'll retire gracefully, I hope, having thoroughly enjoyed my working career.